All right. Hi, everybody. How are y'all doing today? It's Laura. I'm excited to do a medication aid version of what we did in January for CNA prep. And if you are looking at becoming a certified CNA, a certified medication aid, I would say definitely stay, get comfortable. We're just going to spend a few minutes reviewing some of the things that you learn and will be learning in the Certified Medication Aid program. So, for those who may not know, part of the reason why I offer this program is because I was a CMA. So, I started off as a CNA at 16. Yes, I've been doing it that long, and I went and got my and obtained my certification as a medication aide. And then I went and got my LVN. And then, like I always say, like a crazy lady, I went back and got my RN just after praying, like, God, do I really want to do this again? And I did it again. And I'm excited because I am the program director of the CNA Med Aid Anything program at Williams Career School of Excellence. And a lot of times, as a CNA, certified nursing assistant, a lot of times you really don't realize that there's a process and there's a career track that you can go to move up. Right now, I will just preface this and say that we need CNAs, period. Like, I'm just saying, like, if that's your love and you don't see yourself doing anything um, else beyond gaining more knowledge as a CNA and just getting better and better, I salute you, because guess what? We need you. I'm just saying, we need you hands down. And you can add another certification, right? No matter how long you've been doing this, you've seen, I'm sure if you've been in the industry, or if you're a temporary nurse aide, or you visited someone in a healthcare facility, like a rehabilitation, you've seen medication aides roll around with their cards. And I know sometimes you may not feel like that's a job for you. So that's one of the reasons why I wanted to do like a prep course, really wanted to go over the things that you're going to be learning in a program that offers certified medication aid training, so you can wrap your head around what does that look like. One of the things that I really love about the program is you do have more time to learn and understand different aspects of medications, and it's the next level. And if you're thinking about becoming a nurse, I highly recommend a medication aid certification, because you will have to learn meds in nursing school, pharmacology. And if you've had a nursing friend, you already know they've told you pharmacology is a beast. Like it's something to wrap your head around. So if you can get training like a certified medication aid underneath your belt to get your wheels going, I highly recommend this. And I don't regret it. Honestly, as I kept doing this stair step in my career, I began to understand things I didn't understand as a CNA. We don't know all things. And even as a nurse, there's things that I'm still learning. Even as create curriculums and dive into information, try to make that information even more, what is the word? Not just accessible, but make it understanding. I'm always learning. And that's the reason why I love the medical field, the healthcare field, because we're always in the opportunity of learning. So that is why we're doing this. I want you to understand that you can do this. You can do this. And we have an amazing team. We have an amazing pharmacist that is on our team that helps with this. And it's me and our team that's helping you learn and grab a hold of this information. And if you are following me on social media, I've highlighted some students who have successfully completed this program and they're now certified. And I have to applaud these ladies because it wasn't easy. Not all things are easy. And honestly, if you're looking for easy, then you're not living, because life has its challenges. And when you're learning something new, it could be challenging. It is what it is. Like, I don't know why we want things to be sugar coated, because then you're going to feel disappointed because you're going to realize that we lied. So I'm going to be honest with you. There's going to be aspects of this training, if you say yes, that you're going to be like, wow, I got it. And there are going to be some aspects that you're going to have to study and review and try to get other ways to memorize certain things. And I did that in nursing school. Nursing school wasn't easy, but was it worth it? Heck yes. So let's get started. I can't wait to just give you a piece of just a small slice of what we learned in our specific program. Awesome. So the question that we have on the screen for those that are on Instagram, I would go to YouTube because I actually have PowerPoint slides. So if you're a visual learner and you don't want to just see my face, there's questions that are actually live. And the good thing about it, if you miss this and you're like looking at the replay, guess what? It's going to be on our YouTube channel regardless. So it's going to live there. It's going to be there. But I am going through questions and examples here that they have on YouTube to see on a PowerPoint. So the first question that I have on my slide is, will I have to learn about medications? Yes. A medication aide that is certified by the state of Texas or any other state, your main focus of this curriculum is to learn about medications. It is to learn about meds because that is the main role that you have, is to administer, to give patients, residents, the people that you're caring for, their medication. You will have to learn about medication. That is the complete component of this program, is to learn about it and to learn about it, how to do it safely and how to do it well. Okay. So yes, 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 you will have to learn about medications. The second question that I get is it hard to learn about all of the medications? Honestly, I put a yes and a no. And I would even say this as a med aide when I was going through training and as a nurse having to learn medications on another level, that yes, it is hard. And then there's no's because there's certain classifications is what we call it. And when you think about classifications, I want you to think about a house, right? So many people have call a house a home, right? But there's different types of homes. We have apartments, we have duplexes, we have we used to call them, well, they're still called, I think, studios. We used to call them efficiencies back in the day. Um, it may be a remade she shack. I don't know. There are so many different types of home. Now we got tiny houses. Hello, we've evolved, right? So you have these different type of houses, but they're classified different, usually by size, right? Duplexes we know are typically 2-story. That's why you have DUP, like a duplicate, right? So you have duplexes. You have what we call now a studio, which is usually a 1 bedroom, or everything's in one area. You have a home, so we're expecting to have multiple rooms, maybe even multiple bathrooms, and sometimes an office, right? So these are different types of houses, but we classify them or we call them something different because of their size, right? And we have apartments, and that in itself has its own, it could be with amenities, and amenities could be as far as a gym, a pool, right? So just to give you a picture of that, in medications, we have what we call classifications, like houses, that certain meds fit in a certain house, right? So, for instance, we have what we call cardiac meds. This is like anything that has to do with the heart. Cardiac is a medical term for heart. So, in that classification of heart medications, there are several different type of medications that do different things, right? So let's say you probably know someone that has high blood pressure, right? And the medical term for that is hypertension. Hypertension. So in the hypertension or high blood pressure classification, or a set of medications that a doctor can prescribe to treat high blood pressure, right? So then you might have a medication that we would call, let's see, it changes the rate or the beat, right, of the heart. It slows down the beat. So that medication may be in a different house, or it may be classified different, and it's classified different by the way it acts, what it does in the body and how it impacts the heart. Okay, so yes, we learn, and it's an easier way to approach medication learning is when you can understand that high blood pressure meds do this. They lower pressure. They do this by slowing down the muscle of the heart. We want to get that to relax, right? We want that heart to relax, because a person with high blood pressure, and I'm going ahead of my slides, but what happens is if they're sitting like me and you, their heart is still beating like they're running a marathon. And that's dangerous. It's very dangerous, because that means your body never is in a resting period to restore and recover itself. So medication is then added as a regimen to help the heart calm down. So this is how you're going to learn about medications in our program. We're going to break it down. If we're going to talk about a house for you to get it, we're going to talk about water, all kind of different things that make sense to us in our everyday world, so that you can grab a hold of the concepts and the things that you're learning and make it make sense, right? I'm one of those people that I will study a thing until it's broken down to the simplest form, because to me, you will keep it longer. You will learn it and you will hold on to that information, and it is the most effective way to learn. If you get stuff, I call it like over your head, right? Have you ever had somebody talking and it's just not connecting? They're just going over your head, right? I hate I hated to be in those type of like classrooms. So I tried my best to make my students feel very comfortable with asking questions, giving them some breathing time to really process what they've just learned, so that they can get that information and be successful. Okay. One of the other things that we love to talk about is medication, or I'm sorry, resident rights or medication rights. So when we think about rights, I want you to think about what we've heard. We've heard this word more than we have in the past 3 years. I'm just saying. I got a right to privacy, right? You have no business grabbing my phone as a stranger and flipping through my phone and looking at my posts and my pictures, right? Like, I feel like this is my earned right that now has been violated by a stranger. So in medications, we have what we call medication rights, RIGHTS. And these rights are what we follow when we are giving someone medication. They protect us as the person giving it, and they protect our residents. And they're almost like a code of conduct, is what I look at it as. It's a sense of integrity that we are saying that we will have when we administer medications to a person. So these are right patients or right resident in certain arenas. We don't call everyone patients in certain facilities like assisted living. We say residents. But right resident means I need to make sure that when I'm administering a medication, that if it says Sally Rowe, that I'm looking at and I'm giving that meds to Sally Rowe. And we call those things identifiers. If you've ever been in a hospital, they'll ask you, what is your name? What is your date of birth? Right? And that is an identifier. That is a tool for us to make sure we're talking to and treating the right person. We don't want to give the wrong treatment to the wrong person. So that's what right patient is. That is a right that you follow when administering medication. Right medication. Hello, right? Ding, ding. We want to make sure that we give the right medication to the right person, because we can cause significant medication errors. Period. We can cause significant medication errors. And once that medication is entering into the bloodstream of the person, we never know how this person's body will respond. Right? And this honestly can happen if this is a new medication that is intended to solve a condition or problem. We have a risk factor there already. And this is why in most healthcare settings, a nurse is required to give the first dose. This is not in all settings, but in some settings, this is a requirement because we know to assess or monitor patients or residents for adverse reactions, things that we don't want to happen. Okay. So, right person, right medication. Then we have right dose. So, when you think about right dose, I want you to think about if the doctor orders you an aspirin, 81 milligram, 81 mg. 81 mg is the dose that the doctor has wrote an order for. That means I have the responsibility as a medication aide to make sure that the order that the doctor has written matches the medication that I'm about to give. Again, because even though I might have an aspirin 325 milligrams, if he ordered 81 and I'm giving 325, that is a med error. That's considered a medication error. Okay, makes sense? So this is why I'm telling you the rights are a code of conduct for us when we're administering medications for not just CMAs, but anyone in the medical industry that is administering medications of some form. Right route. All right, say with me. I might be saying a little, with a little something because of my Louisiana, but just say with me, right route. So when you think about route, think about a pathway, right? When I, put an address in my phone, it gives me a route to get to my destination, right? And sometimes my destination might be an ice cream shop with chocolate or something. I don't know. It just depends on what's happening. You want to go in the right direction, right? Because what does Siri say? Wrong, wrong way. They like it puts you on a U-turn. Okay. So the doctor will say, I've ordered aspirin 81 milligrams to be given orally or by mouth is the terms that are usually utilized. It means that I'm giving this pill in the person's mouth. Like this person needs to have this pill, needs to go through their mouth with water through the system. That's the right route. Like, what if the order said that the aspirin should go underneath the tongue? Is those two different routes? Yes. Yes is in the mouth, but there's aspirin that dissolves, right? So as soon as it enters the mouth, it dissolves. You don't even have to swallow it. If you've ever had a med like that, it usually tastes like candy. And that means that the doctor wants it to go underneath the tongue because that's a different way for this medication to be absorbed enter into the body. It's actually quicker than going down the throat. So the right route is important, and we have a way to communicate to a medication aide which route this med should be given. Okay? Because we don't want to give a medication that maybe should go in ear, like an eardrop in the eye. Get me? Like, no. If it's an eardrop, it needs to go in the ear. It doesn't go in the eye. So you're going to learn about routes and how is that usually written on a MAR or a medication list or on a system that your facility is using. And sometimes there's paper MARs or paper, we call them MARs, meaning medication administration record. It's a list of meds with complete directions given by the doctor to us. Right time. Let's say time. We need to give our meds on time. Why? Because let's say we had a blood pressure medication that is prescribed 3 times a day. Let's just throw something out there, right? And we have to give it at 9, at noon, and at 8 p.m. Let's say, a med aide walks in and she gives the med, instead of giving it at the first one at 9 a.m., she gives it at 11 a.m. And then here I come, not realizing and knowing that happened. I give the next blood pressure med at noon. This is an hour difference between these two medications. This resident could be negatively impacted because we didn't follow the orders. So making sure we're giving things at the right time is vital for the overall well-being of the person we're giving it. And this is why I consider this job one of these most serious jobs, because you can't just treat it any kind of way. It's not like, you know, the state requires you to be a CNA or work in, or if you work in assisted living and you're not certified, you have to be in that facility at least 90 days to be able to take a certified medication aid program. Okay. I want to give an example of the difference because, like, let's say as a CNA, Mrs. Smith, we forget for whatever reason, it was a busy day. We had a lot of incidents, emergencies. So we didn't get to take Mrs. Smith her shower. So we did a bed bath, but Mrs. Smith's like, I really want to take a shower. So we may communicate to our team member, said, hey, can you take care of Mrs. Smith's shower? I totally forgot. I did clean her up really well and helped her in that area, but she really wants to take a shower. As a CNA, we can potentially just work that out in that way. The resident will be satisfied. It won't cause significantly any harm to the resident. We've communicated to the resident, we've communicated to the nurse, we've altered our schedules, right? But with a medication, if we do not give the treatment that the doctor has prescribed, that organ, that system, that disease that we are managing, the disease that we're managing can be negatively impacted by us not being able to do it the way that it should. So this person, now we didn't give the blood pressure med. We gave two within an hour of difference when it should have had almost 4 hours gap. Now this person blood pressure is significantly low and they're almost about to faint, and we might be in an emergency situation. So right time matters. Then we have right documentation. If you're in the medical field, you know it. If you didn't write it, it didn't get done. It is what it is. It doesn't matter that it got done, and more than likely your boss, your supervisor knows it was done, but if you didn't write it, guess what? It wasn't done, right? So documentation and documenting your medication is vital. Right reason is another right. Right reason. What does that mean? If the doctor prescribed a blood pressure medication for the resident, and the resident says, hey, I have a headache, and we start thinking that, my aunt, when her blood pressure is high, she get a headache. So maybe Mrs. Smith blood pressure is high. So instead of giving her a Tylenol, I'm going to give her a blood pressure medication. That is not the right reason. The reason the doctor wrote the blood pressure med is because if the resident or person's blood pressure is higher than a certain value that we measure with a blood pressure cuff, we then give that medication. We don't give it for a headache, we give it for blood pressure. And we have a measurement, a number or numbers that we utilize as a tool to let us know when we should give or not give that medication. Versus the headache is pain. She's communicating she's in pain. So that is a different type of pill that we would give to resolve that. So that's right reason. We have to make sure that when we're giving a medication, that it matches the intent that the doctor listed it for, and not bring our home scenario into that, if that makes sense. Okay. And right response is one of the last rights we're going to go through today. Right response. What does that mean? If I give Mrs. Smith a Tylenol for her headache, within 30 to 45 minutes, I should be able to go back to Miss Smith and ask her, hey, how is your headache now? And my hope is that Mrs. Smith says, oh, it went away. The pill worked. That is the right response. Okay, so right patient, right medication, right dose, which is like milligram, right route. Where is the medication? You know, how is it getting applied or entered into the body system? Okay, right time, right documentation. Am I, signing off that I gave it? Did the resident refuse it? Things of that nature. We have to document what we do or don't do. Right reason, does it match the situation that the resident has communicated? And right response. So these are like what I call the blueprint of in conduct in which we should be administering medications. And these are some the things. One thing, like we've talked about a lot in with 8 rights, but it is the thing in which you will be living by. These medication rights is the thing in which you would be living by when you're administering medications. So this is something to keep in mind. All right. So the next thing that we talk about in our program is, what is a medication error? What is that considered? And honestly, the best way to know what an error is, we really kind of reviewed it already. We really did. Is all the rights going wrong. So all of those rights that we just talked about going wrong is a medication error or medication. It's not even a mistake, but it's considered an error. And this is something that can cause great harm to a patient or resident in your facility. So if you give it a medication to the wrong patient, the wrong medication, the wrong dose, the wrong route, at the wrong time, you don't document, or you document incorrectly, you give it for the wrong reason, like in the example I just mentioned, or the resident has the wrong response because of any other of these other rights. This is what a medication error is all the rights going wrong. Medication effects. We learn about medication effects because, like in the other example, we want to know, is it effective? Is it doing what it has been ordered to do? Or is it causing a different effect? One of the effects that you probably hear in every medication commercial is side effects, right? It's almost as if they list a whole book of, this medication may cause your eyeball to fall out, your leg to twitch, like you're like, oh my gosh, I don't want to take this medication. But you do learn about common, and the key word is common side effects. You won't have to learn a book of those things, but you will know the most occurring side effects. Like if a pain medication caused drowsiness, which you have probably experienced if you've ever taken pain meds, that's a common effect. You don't have to learn a book of them, but you need to know what are the most common things that may occur when given this type of medication. We call it an undesirable effect because in reality, we want a pain medication to relieve pain. We really don't like it to like make a person drowsy, right? Because it could create an unsafe situation. And this is why a lot of times doctors will tell patients or residents, don't drive when you're having to take a medication like this, because it may make you sleepy, it may make you drowsy. Some other common side effects you will see with medications you will learn in our program is like nausea, vomiting, like being sick to your stomach, feeling tired, dizzy, headache, itching, some aches and pains. And honestly, it's truly based on the medication and also the person's body. Everybody is unique. And maybe one medication works just fine for another person, but that same medication can cause severe issues in another. We also learn drug reactions. And when you think about a reaction, it's almost like a conversation. You hear something, you react, right? So when you have a drug reaction, we talk about local and systematic responses or reactions. And what that means is, let's say you order a cream. Let's say you are in the garden, or you touch the plant and now it's itching on your hand. You can go to the store and buy maybe a Benadryl cream, rub the cream on the hand, and it resolves the itching. This is called a local effect. And that just means that where I put the medication at, it it takes care of that, right? This also means that this person will not have any other side effects in their body. Like they're not going to feel drowsy. They're not going to, this cream is not going to be necessarily causing anything else in their body. Like it's not going to make their stomach sick. It locally is treating the itchiness, and it takes care of it only in that area. It doesn't impact any other area that it is not applied. If that makes sense. Another example of that is Oragel. I thought about, like, when you have a toothache, when you get Oragel, you apply it directly on the tooth. Yes, it kind of makes your throat feel numb, but it's local, right? It's there to take care of the pain there. It doesn't necessarily, if you had pain in your foot, you're not going to feel the effect of Oragel in your toe, right? It's just going to be where the Oragel is applied. It's locally effective. Systematic example is like a pain medication. Like if a person has pain in their foot, they're going to take it orally, but anywhere in that person's body that there's a pain response happening, the pill should be effective. But it's literally going throughout the system to be effective. So you're going to learn about meds that are locally effective, or it's something that has to go throughout the body to be effective. Another example before we go is high blood pressure. And I love this example because it's usually something that everybody has some level of knowledge on. High blood pressure is known as hypertension in the medical term world. Hypertension, right? So when we're thinking about high blood pressure, I want you to think about, again, that heart is racing and it's beating and it's going, even though this person is at rest, kicking up their feet. That's dangerous, as we've already established. And it not being managed can cause significant problems. So when you're thinking about high blood pressure, we're going to learn about what does blood pressure medications do? What is the action? What does it do? Like a bike should roll when a person sits on it and moves the pedal, right? That's the action of the bike. We're going to learn about the action of a blood pressure medication. What does it do to cause this fast beating muscle, the heart, to slow down? How does it accomplish that? Different medication can act in a different way to make that result happen. So another example is like for a bike, even though it has two wheels, two pedals, handlebar, it takes multiple ways or things to happen to get it rolling, right? The person has to get on the bike. First of all, they can't fall off because it's going to stop. They have to put each foot on a pedal, and they have to move the pedal forward, and they have to have good balance on the handlebars to guide the bike, right? So blood pressure medications, in almost every medication, they have actions. They function in different ways to accomplish a certain result. So this is a way to just remember this, and this is something that we do in our program. Is we may have you, and we will have you create what we call mnemonics, ways or sentences or sayings or music. You're going to find ways to memorize things and make it simple. My biggest learning nugget to our students is make it make sense to you. I may make it make sense to me, and that may not click for you, but you want to break something down to the point that it makes sense to the way you're thinking. That's how knowledge is received and really understood. And your goal in a program is to leave away with understanding, not where things are just flying over your head. That's not effective for anybody. You want to leave away with understanding. So I created this mnemonic real quickly to give you an understanding of what different blood pressure medications may do. So my mnemonic that I made real quickly in preparation for this time is Wendy ran home. And we're going to use the beginning of each of those words to understand what blood pressure medications, the actions of different ones will do. Wendy ran home. So the W is for widen. So as we know, we have arteries, we have veins, and those arteries carry blood. So one type of blood pressure med or a certain group of blood pressure meds may widen the arteries to release pressure. All right. And this may make sense. Let's say we have a jug like a what is it like carbonated soda, right? And you know how back, I don't know if you've done this when you were a kid, you shook it up, and then when we would trick our friends and we would open the top and it would just explode. And it's because when we shook up the carbonated water, it increased the pressure, so when we open it, it explodes. But if we just handle it right, it wouldn't do that, right? So when we just handle the arteries correctly with a certain group of meds, what it does is it opens it up. And so when we open up that artery, it doesn't increase the pressure. It won't explode in our face. And this person's blood pressure decreases. Another thing that it may do is it may remove another type of a group of meds may remove fluid, like we call those, like in your words it may be water pills. We call them something else, but I'll use that term for knowledge, right? Water pills, right? What does water pills do? It makes a person go to the bathroom all the time, like it's almost like they drunk gallons of water. But what it's doing is it's releasing and removing extra fluid to, again, decrease pressure, and it lowers the blood pressure. Another type or group of medications may be hormones. It may act on certain hormones that actually contribute to the blood pressure being raised. So what it'll do, it'll cause those hormones to not work or not be released, so that this person blood pressure can stay in a certain range. So I just wanted to bring you into the classroom setting and help you understand what are some things you're going to learn, how we may break it down. And I'm sure I've given you a glimpse of that just to bring it home, how we can make something that may seem so challenging and hard to wrap around. I really try to think through, how can I bring this home so that you can understand what a medication does, how it acts, and how it behaves in the body. And when you join our our medication aid program, look, I'm already telling you you're going to be certified speaking it, right? But our medication aid program, you're going to learn things like this. And honestly, you're going to, just like this young lady on this picture, you're going to be blown away at all of the information that you learn and how much you understand this. So with ending, I want to make sure that I invite you to become a medication aide today. Join our upcoming program. We would love to have you. And honestly, this program is mainly virtual, so it's very convenient. It's an evening class and program. We do have an option for day class. It's all about the interest, but a lot of CNAs take the class, or caregivers, or resident care aides. They work during the day, so it fits the schedule. But I would love to have you in our class and learn and get a new skill, get some more money, and honestly take care of the residents in a different way. So thank you so much for joining me on this quick review on what we learned. So remember, I will be back at the end of March, and we will do another medication aid prep on the 30th at 7 p.m. to give you even more of a glimpse of what the state test will look like, some questions, and some skills that you're going to learn. Thank you so much for joining me. Y'all have a good night.